My name is Hubert Zaitchik. I'm the founding president of the SOPE DFW chapter and also CEO of Health Wildcatters. So, welcome to the Zoom with our guest. I'll introduce here in a second, Dr. Harvey Castro. We are delighted to have you. I wanted to give you a quick second here to understand what SOPE is and what Health Wildcatters is. SOPE is the Society of Physician Entrepreneurs with chapters all over the country, even internationally. And it's an organization that's really open to anyone interested in healthcare that has a professional background in healthcare generally. It is a membership organization. You can join the SOPE national organization on soapnet.org. And it's an annual membership. And when you have done that, then you would be able to email your local chapter, which in our case, we're in Dallas-Fort Worth, so in the Dallas-Fort Worth chapter. And then we will let you into our LinkedIn group here in Dallas, which is kind of the mechanism by which we interact with each other. So Dallas-Fort Worth has a LinkedIn group that is not open to anyone except SOPE members. And so that's kind of the way that works. Again, as the name implies, Society of Physician Entrepreneurs is really interested in bringing together resources and information and mindshare between entrepreneurial-minded physicians. Again, when I emphasize any kind of healthcare professional is welcome, however, so nurses, doctors, dentists, you name it. On Health Wildcatters, real quick, since you see it behind me, we're a healthcare seed accelerator in Dallas. So that means we invest in early stage healthcare startups. And that is my day job. We have invested in 99 startups to date that have raised $250 million. Couple of things before I introduce Dr. Castro, just on housekeeping. Number one, as you entered the room, you were automatically muted. Do me a favor and stay muted. We're going to take questions at the end. Number two, you're free to send questions in the chat, and Dr. Castro and I will look at those towards the end. And he will also share his connection information so you can connect with him personally. And then lastly, if you want to see Dr. Castro in full format, I recommend that you go into a view in the right upper corner of the screen in front of you and click on speaker mode. That way you will see him in full format and aren't distracted by whatever everyone else is doing. So that's just a suggestion. So now it's my pleasure to introduce my friend and physician here in Dallas, Dr. Harvey Castro. As you can see, not just a doctor, but also has an MBA. He's an emergency room physician with extensive experience in not just emergency medicine, but also on the entrepreneurial side. He started over 20 startups in his lifetime. He's published, he's gotten and was always entrepreneurial throughout his career, even in med school. There's all sorts of stories. This would be way too long to tell you. But he's been very successful, always on the cutting edge, and always interested in the next thing. And so it's our distinct pleasure to have him here. And in case you didn't catch the hint there, what is behind him is his newest book, which I've also read on ChatGPT. And of course, that is also the topic today, ChatGPT in healthcare. So with that, I'm going to kick it over to Harvey. Harvey will speak for a while, and then we'll kick it over into Q&A mode. We do have a hard cutoff at 7:30, probably at the very latest. We will have to stop at 7:25. But for now, it's my pleasure to introduce my friend, entrepreneur extraordinaire, Dr. Harvey Castro.
Hi, everyone. Welcome, welcome. Thank you for coming. I know it's after hours. Everybody's tired, hungry, ready to hug their kids and babies. So thanks for taking some time to hang out with me. First of all, I always like telling everybody what's going on. If you look at Harvey's Yodi, whatever that's on the screen, I actually have an AI that evaluates my speech. So every time I pause, every time if I were to say if my grammar, it literally gives me a report card, and it's free, and I put the link on there. It's pretty fun. I know my boss has mixed feelings about it because it calls him out on his dialect and what he says, and if it's too childish or not. So it's kind of fun. I like it a lot, and I evaluate myself every single time I give a talk. So I just leave it at that. So ChatGPT in healthcare. So let's talk about it. I want to give you a kind of quick background. First of all, Herbert, thank you so much for having me. Just so everybody knows, full disclosure, Health Wildcatters, I've been investing for a couple of years now, and continue to enjoy investing and being part of the group. So I just want to say that part. Back to ChatGPT. I like giving this story. Basically, as an emergency board physician, I was in the ER, was coding a patient. And when I was coding the patient, this was when the first iPhone came out. And so at that time, I noticed that I had asked the nurse for a titration of an IV drip. I think it was dopamine. And I noticed that by the time she got the book out, table of contents, found the drug, and started the drip, I thought, this is taking too long. And I thought, surely there's got to be a better way. So I started something called IV Meds, and it was the first IV Med app in the App Store. And it actually made it in the top 10 in the world. And from there, I ended up making about another 30 apps. And that was fun, and all in healthcare. And so the reason I like sharing that story is when ChatGPT came out, I stumbled across it right away. And I started playing with it. And this was in probably late November. And I thought, this is an amazing tool. And it reminded me of the time when I was writing iPhone apps. And when I was writing iPhone apps, I noticed that at the beginning, I was submitting all these apps and Apple Store was rejecting them all. And I was kind of upset because I was thinking, this is not, it's not medicine, but it's helping physicians. But the App Store was telling me, no, we're going to reject these. And I look at the App Store today and I look at the apps that I was trying to submit, and all of them would have been accepted today. The thing is, I guess I was too early onto the game. And I like sharing that story because I feel like ChatGPT is the same thing. And so I'm here to kind of give you a background why I did it. The reason I did ChatGPT in healthcare, honestly, I don't make any money. I don't own ChatGPT. I don't own healthcare. I'm literally doing this because I enjoy the technology. I think it's the future of medicine. And I made it a point to make sure that I understand this to the point where I can educate others. And so my goal is exactly what ChatGPT healthcare means. It's ChatGPT and healthcare. How can we bring these two entities together to create a better product, to make a better healthcare experience? And so when I look at this as an entity, I think obviously it's pros and cons. Everybody is out there that knows about it. Some do, some don't. Just to give you a quick background, this is the fastest technology that has ever been seen to man. So late January, they reported that after 2 months of being out, there was 100 million new users on their platform. And so me being the geek that I am, I looked and said, that's roughly about 1% of the entire world is using ChatGPT. And doesn't sound like a big number. But to me, it kind of is, because I'm thinking, man, 1% in 2 months, I would start that business any day. And so let's talk about the next question is, what the heck is ChatGPT? And it's to me, it's the hardest question to answer because, to me, I like giving examples. So what is ChatGPT? I see it as a friend that I can ask anything I want, but unfortunately that friend can tell me anything back. And if I don't understand what he's telling me, I may believe, or he or she or ChatGPT, I may look at it and not understand it and say, oh, that's valid. And in reality, it's false. And that's called the hallucination effect. So let me explain. So ChatGPT is generative AI. And basically in a sentence or two is basically you can ask it anything and it'll return an answer. But it's not going into the internet. It's literally generating based on data that it has in its database. And so my example that I like to use is if I have a patient that's diabetic and I want to educate my patient on diabetes, I can say, go to ChatGPT and prompt it and basically say, I have a 50-year-old male and they need to eat a low glycemic index of sugar. And then I'll pause right there. And then most people out there are like, well, you can do that on Google. ChatGPT has nothing on Google. But then here's the part that it gets interesting. I could tell ChatGPT glycemic index, I need 3 meals and this patient is allergic to eggs, gluten, and they hate fruit. And so give me a diet, and it'll give me a diet. And if I said that I wanted 3 meals for 5 days, it'll give me 15 diets or recipes. And then if I say, give me a recipe, but then I need to go to the grocery store, give me a grocery list. It'll take that data, give me the recipes, give me the data for the grocery, and then make me a list. And say I like to see this in the column, it'll create the columns for me and put it in columns. And say, um, let's say we're in Dallas right now. Say I want to go to New York. I could say, I'm going to New York. I need the restaurants that I can go to for my diet, and it'll give me a list of those restaurants. That to me is not Google. That to me is personalized. That to me is customized. And so let's talk about, well, as a doctor, we're here for healthcare. Can we use it in healthcare? And so that's the part that gets a little bit tricky. And so when I look at healthcare, I look at it in 3 phases: before you see a patient, when you see a patient, and after you see the patient. And so when I look at it before the patient, from a doctor's point of view or healthcare provider, because I know there's non-doctors out there. So let's just say from a non-doctor point of view, what can I do before I see the patient? So if I have ChatGPT, I can use it for education. So how do I use it in education? ChatGPT, if I'm struggling, let's just say with the Krebs cycle, that's a bad example. Say I was struggling with heart flow, I could ask ChatGPT to help me through cardiac heart flow, and basically walk me through and teach me. And it can make my note cards for me. It could make tables for me. Or if I have the chapter on PEs, I can cut and paste that one chapter, put it into ChatGPT and say, summarize this chapter. And so from an education point of view, it sounds good because I can get information. Now, obviously, some people out there are saying, well, there's a lot of data out there that says this information could be a hallucination. And let's talk about that. My classic example is I'm an ER board certified doctor. If ChatGPT gives me anything in ER, I feel comfortable saying this is valid or invalid because I've been doing ER for over 20 years. So I know ER pretty darn good. But if I ask ChatGPT, I have a friend of mine, he's a pediatric cardiac surgeon. And he basically, I'm going to share this quick story. He went in and typed in all the symptoms of there was only 20 cases in the world. And he typed in all the symptoms and some pictures and radiology findings. And ChatGPT gave him a differential diagnosis and told him what likely diagnosis it was. And he was shocked because it was able to give it to him. Now, if I put those same symptoms and it said it, I wouldn't know because I'm not a pediatric cardiology and I don't really know that space. And so my point is this: use ChatGPT with caution. If you know that space and you're using it in healthcare and you've been a family practice doctor for 20 years and you ask it, you'll know if it's correct or not. And so let's look at it from the other side. Patients, how I see patients using ChatGPT, I honestly think they could be a better informed patient when they come to our clinic. Know that every doctor the average doctor time with the patient is about 13 minutes. And so really the only education they're getting from you is just those 13 minutes every time they see you. And if they only see you once a year, that's it. And so my challenge with ChatGPT is a patient, say they had diabetes again, they could say, hey, I need to know what questions I can ask my doctor and the follow-up questions, and it'll generate those questions for the patient. And so I feel like ChatGPT can help the patient have a better engagement with the physician. The next division I do is the patient interaction. That kind of goes back to my first point. You know, as an ER doctor, you know, I remember multiple times working 24 hours, 30 hours, and in my last hour, I'm exhausted and looking at differential diagnosis, looking at things with patients. I remember being on the fence on certain things. I think I have talked to some colleagues and they said to me on patients that they're really stumped, they're putting those symptoms in to ChatGPT and seeing what it spits out. In the future, I see it being a probability where you'll put that in and then it'll tell you probability of this being for that patient. And I think that's coming. Now, a couple of things I want to say. Number one, can this be used in medicine? Yes and no. It depends on who the user is. Other things, I know I'm talking about a lot of separate things, and we'll do the Q&A. We'll go into those specifics. But it's all about the prompts. So as a doctor, I can prompt the computer a certain way. I can prompt ChatGPT to go down a certain way. But if I wasn't a doctor and I asked a certain question, I wouldn't word it that same way. So what I'm saying is what you put into the computer, what I put into the computer, we may get two different outputs because it's generating it. So keep that in mind. So we talked about seeing a patient. So with that, I'm starting to see some how to figure out the differential diagnosis. On the tail end of that, I'm also seeing interactions with patient education. So I've had different companies ask how they would do this, and there's what they're starting to do is interface ChatGPT to their websites for a specific realm. So I'll use diabetes as an example. If they are specifically talking about different therapies in diabetes, then they're having ChatGPT create all that content, putting it on their web. But just before putting it on the web, they're making sure that a physician that knows that space can look at the document and say, yep, this looks good, and then give it its blessings and upload it. From a ethical and FDA point of view, that's another question that's often asked. From ethics, I'm not sure who's read what, but there have been some studies out there where from a mental space, they've had apps that were ChatGPT talking to patients and going back and forth. And then the patient later found out that it wasn't a human being. It was actually, we're talking to a bot. And for ethical reasons, if I was a patient and I was talking to a robot and didn't know that, I would be quite upset. From an FDA point of view, there's 18 identifiers under HIPAA. So basically, someone brought this up and I hadn't thought of it. If a patient is using ChatGPT but doesn't put their address, phone number, any of that, but then their IP address goes back to their address and they're putting all their symptoms, in theory, that's a HIPAA violation because you can identify that patient because it's that IP address and they're putting all their information. So I hadn't thought of that, but that's actually a valid point. Depending how you use ChatGPT, and I'm always struggling with lawyers with this one, will determine if it's an FDA approved device. And then the definition is pretty loose, so it's kind of hard. And that's where I'm kind of watching in the back lines to see how different industries interpret that and to see how the FDA comes down on ChatGPT or not. With that said, there's been over 100 different AI algorithms that have been approved by the FDA. And so we'll see how that space moves forward. The other part that literally came out yesterday, hot off the press, is Doximity, as you all know, is our physician advocate out there. But Doximity came out with something called DocsGPT. And DocsGPT is on their website, and it's pretty fascinating. I encourage all you guys to play with it later today. But basically, the front end is all the administration stuff. So if you want to argue with Aetna about a patient not getting X procedure approved, it has interfaced the ChatGPT, creates the letter, and then it interfaces with Doximity to fax the letter for you so that you could argue with the insurance company, which is interesting. Other things that they've added SOPE notes, they've added post-op notes, and then they have, I think, a differential diagnosis with someone with crushing chest pain. So they're starting to use ChatGPT and integrate it with things that we do as physicians. So that's a beta. They said they're still working the kinks out, but they're letting Doximity users out there to use it. It's kind of interesting to me. So I wanted to share that. I'm trying to think what else. Those were kind of like from 10,000 feet high, what's going on. So let's talk about other things out there. I say ChatGPT to me is kind of like saying Kleenex or saying, Xerox machine. I think it's the first player out that came out and said, hey, play with this function. And everybody jumped on it and they think this is the only thing that's out there. Well, that Google announced a code red, meaning, hey, we may lose a lot of our membership here through ChatGPT, and they have something called Bard, and they basically is like a ChatGPT equivalent, and that's supposed to come out. And so what's interesting to me is moving forward, there's all these different languages coming out. The other one that I'm following closely is something called BioGPT. And I think that is going to be the one we end up using as doctors, not necessarily ChatGPT, but I think it is going to be one of these. And I think it may be BioGPT. And all it is they're going into PubMed, they're going into different healthcare databases. And so when you ask a question, it only has a database from these published papers. And so these published papers will be able to yield a better response because its database has just medical journals or medical content, as opposed to ChatGPT that has everything else. I've been following this space, and it's really interesting, all the predictions that are coming out. There's some predictions that are saying that we are getting close to the point where we are going to run out of data to put into ChatGPT, where they're going to have to start listening to podcasts or conferences to be able to add more information into ChatGPT, because it's getting close to maxing out as far as all the data that's coming in, and which blows my mind. So I think with that, that's kind of like a good big overview, and we can start doing some Q&As and we'll go from there. So if you guys want to start putting in some questions in the chat area, and then I can look at them and we can kind of field them as they come. Herbert, do you have anything that comes to mind so far?
Yeah, well, it's fascinating. It definitely is something that I encourage everyone to play around with. If you're in this field, then I mean, just got to stay on top of it. This is really revolutionary. I have a friend who is in the pharma industry, and he's actively using ChatGPT for a variety of kind of mundane tasks that he is outsourcing. So that's not per se doing anything in healthcare, but in a sense it is, because he's using it to assemble knowledge and to write a report. And of course he has to go over that and then edit it. But it's definitely having an impact on a variety of industries. I think healthcare is always going to be a little bit harder. It's just by definition more complicated and potentially dangerous, or or a liability.
Yeah. So
yeah.
let me jump on that. So on the liability side, I personally don't ever see OpenAI saying we are officially going to take the liability of healthcare, and this is it. What they're doing is creating an API and letting everybody else use their technology, but then it's on them for using their technology and on the HIPAA side or those things. So I spoke to a lawyer a couple of weeks ago, and she made an interesting argument. She said that eventually, if AI becomes so good that it becomes the gold standard, then if you don't use ChatGPT or equivalent, whatever that gold standard is, then you could eventually be held liable. And then at that point, if that becomes the gold standard, then at that point is when you could sue OpenAI. So a couple of things I forgot to mention. ChatGPT was able to pass USMLE step 1, step 2, step 3, but what people don't realize is they took out all the pictures out, and it's all the questions, all the clinical vignettes, which is still impressive to me that they was able to pass. And so that brings me a great transition into the first question here. It says, can you speak to MedPalm? And so the way I see MedPalm is as follows. We have Microsoft, and we're going to talk about the history real quick about that. We have Microsoft that created ChatGPT, or not created, invested into ChatGPT. And then we have Google that invested into MedPalm. And so in my mind, it's the same, similar into the database. They both are using the database from a PubMed. The difference is the amount of databases that they're using. And so to me, I haven't really super studied it, but from 10,000 feet high, when I look at MedPalm, I see they were very strategic. They've been very, I don't think it's, how do I explain it? I think they're very strategic. It's very specific. And I think the other one is more sensitive. And so I think from the MedPalm, what you get in, whatever input you put in, whatever comes out, it'll be really good, but then it won't be able to hit all the different topics, but it'll all be medical. Whereas I think bio will have more information, but it may be too sensitive, if that makes sense, that analogy. Next one, thanks for making awareness education. Could you talk about that? Okay, same question. On the education, just while we're at it, because I know that's another controversy, this is going to change life. This is going to change the way we do business. This is going to change the way we go to school. ChatGPT or these languages are here to stay. And I don't see this going away. So education now is going to have to do a paradigm shift. They know that students are able to cheat or do ChatGPT and submit papers that way. So now the education system is going to have to start testing them in school. Instead of having papers, they're going to have to present. There's many things that need to be changed. So with that said, I think medicine is going to follow suit. Now, medicine is slow to evolve and to do certain things, but I think it may not be ChatGPT per se, but it may be BioGPT. Let's see. Are there any tools to identify false, inaccurate responses? See, that's the hardest part. And that's the part that I worry about, this hallucination effect. In theory, if you have a question, that's probably why you're going to ChatGPT. But then if it's something very specific and it gives you a half-truth answer, there's unless you're an expert, you won't know that that is incorrect. And so I worry that I I wrote another book that comes out next week, and in there I'll share this on the website, but it's an algorithm of how to identify data. But basically, at the end of the day, I feel like we need somebody to verify it. So to answer your question, that person is us. And so if that question has to be with ER, then I can answer it. If it has to be with something not in my specialty, then I'm going to ask that doctor to verify. So right now, there is no good way. The way I think of ChatGPT is it is really good at a lot of things, but then when it responds, unless you're good at it, you may not know. So if it's mundane things, you can ask it and you'll know yes or no. But if it's something very specific, it may say a half truth and you may think it's right, but it's all incorrect. It says, thanks, Harvey, for insight. Have you observed let's see, ChatGPT blockchain, especially smart contracts? You know, that I have seen a lot of information out there on blockchains, and there's some companies out there that are startups that are looking at blockchains for credentialing, but I haven't seen a final product or anything that uses both. And to talk about using two technologies, I do think that is going to be the future. I think our wearable devices, our apps, our languages like ChatGPT equivalent, I think all of that's going to merge into one product. And I think in the next few years, we're going to start seeing merging of different technologies. So like blockchain will merge into ChatGPT. Just as a quick statement, I was fascinated when I just thought, I've been talking to different companies and one of them was blockchain for med school. And what they're thinking of doing is create a blockchain. Your medical school basically gives your blessings that you went to med school, and then you have your credentials, at least from the med school part, that's with you, and then you can validate to say, yeah, this is where I went to med school. And then the goal with a lot of these startups is to create a blockchain that will basically take your career. And so that way, when you need to get credential at hospital A, B, you know how it could take 3-6 months to get credential. This way you have your blockchain that can get you credentialed everywhere pretty quickly. So that's going to be kind of fun to watch. Any other questions, concerns, gripes?
Well, let me ask you something. There's Chris.
Yeah, we got a question.
Go ahead.
Hello.
There you go. Yep.
Hello, Harvey. Thank you for doing tonight's talk. I'm wondering if you've looked into AI as it relates to image editing, like Stable Diffusion or other kinds of, AI tools that manipulate images, and have thought about how they could be used in healthcare.
Great question. And I've seen two different sources, and this blew my mind. So thanks for bringing that, by the way. One was a case in the UK where a medical student was discharging a child and took their discharge instructions, took them and put them told ChatGPT to translate it to a 5-year-old level. And so it converted the adult language to 5-year-old language, and then took that and said, I want to create a coloring book, and then converted it to a child's book, basically. And then went to Dolly. I can't remember if it was Dolly or one of the diffusion websites where it basically does the art AI, and then added the artwork for the discharge. And then the hospital has adopted that. And so now when a child gets discharged, they use those images created by AI combined with ChatGPT put together, and that's your discharge summary. And I thought, wow, that is amazing healthcare, because as a parent, you see it, but how amazing for a child to be able to color and learn and understand their medication and their disease process from a coloring book. I thought, genius. So I think that was a good example of that. And I saw another hospital do something similar. Good question. Another question here, is ChatGPT biased towards guideline recommendation therapy or inclusive to any pre-GMT data for pharmaceuticals? Good question. And so I don't think personally ChatGPT was designed for any one therapy or another. I think it's just taking all the databases and it's making its own conclusion. And that's where it gets a little dangerous. That's where you have to be an expert in your field. And I do want to talk about general biases. This is kind of an interesting question or a dilemma. Let's think about this. If we're all scientists here, basically, if we study something and we get a result, we're going to put it in a database, call it ChatGPT. But if there's a population in the United States that is not research, then that population is not in the database. Therefore, there's a bias towards that other population. And so from an ethical point of view, this brings bias as a huge problem, because in theory, you can argue that those populations that have been studied are going to be very well represented in the database. And those populations that have not been studied are not going to be able to use that same resource to go into ChatGPT and say, hey, I need XYZ, because they haven't been studied, and their data that they're getting, I use the bell curve analogy a lot. That data has been studied in bell curve for a certain population, but hasn't even been identified for another. Hopefully it applies, but if it doesn't, we're creating some biases in a database. And then to take it to another level, I just met with a group in Nigeria and to help them create some different platforms in pharmacy for ChatGPT. And my worry is, if certain people don't have the internet, then they can't even afford to get on this website. And let's say OpenAI is free for now, they're not going to be able to get access to this information. So in theory, you can argue that this bias is going to start creating an issue with people on the financial side. And I just like talking about it just to kind of make you think. How much deep understanding ChatGPT can provide in medical terms and medical coding? I haven't done it myself, but I have heard that it has that information that you could put in, diabetes or foot ulcer, and it'll give you the code for it. And so that information is supposed to be in there. So, but yeah, I'd love for you to try it tonight and have a reference book and look at it and see how accurate it is. And then that's the thing. I don't think a lot of this technology was meant for this, but we're starting to push it. And that brings me to my other point. I'm a big advocate for our patients. I am doing all this because my sincere worry is there's going to be someone out there in the world that's going to self-diagnose, and it's going to be outside the United States, and they're going to walk up to the pharmacy and say, I need this drug. And in those countries, it's allowed. And they're going to take that medicine and hopefully nothing happens. But my worry is if some bad outcome comes, what if they take a medicine and they don't even have the disease because ChatGPT told them? Or what if they take a medicine and they die because of an adverse reaction? And so that's where I think this is never going to replace a human. This is going to make, we have to give it the doctor's blessing. And I say never cautiously, because maybe 10, 20 years from now, we might be at a level that it may be able to do some of these things. Let's see. How far is it from clinical modeling? Well, I encourage you all to go on to Doximity's website and see some of the ways that they're using this they're trying to get this to use in the clinic. I will advise everyone to be very, very careful. They have fine print underneath where you hit enter that says don't put any HIPAA violation stuff into this. So make sure you don't, because once you put it in, it goes into their database and you are violating HIPAA. My answer to that is the following. There are millions of companies waiting for ChatGPT to come out with what's called an API so that they can take their software and add it. And so I really think in the next month, this is my guess, this is going to come out. And when this comes out, we're going to see many medical applications, because I'm already talking to different companies of how they're going to integrate this. So it's coming is what I'm saying. And so stay tuned, learn it, play with it, get on the website. I'm not advocating myself, but I'm on LinkedIn and I'm constantly posting about this stuff. I created a small group for this called ChatGPT in Healthcare, and it's under LinkedIn. And all I do is post articles there and have scientists, lawyers, people talk. We have debates there just to talk about this subject. And so I wanted to do this talk for two reasons. One, obviously for patient physicians, but the other, I don't want you guys to be in the clinic and then a patient showing up with some output from ChatGPT and you not have any background to say, well, this is right or this is wrong, or even worse, never have heard of the subject, and then the patient showing you something, and then you lose credibility, because then the patient's like, well, my doctor doesn't know about this, but I know more than my doctor. And I don't want that to happen. I want us all to understand this and really become a student of this, and then go out to the public and be like, okay, I got this. Because at the end of the day, everybody in this room, we're all leaders. And I don't want someone with deep pockets pushing this technology and telling us how to do this in healthcare. I want us that are taking care of patients, that are directly involved with patients, to be the leaders of this ship. Next question. I think ChatGPT 3 can provide API. Yes, you're right. That one can, but the new edition is coming. So that 3.5 is the API should be coming out soon. For fun and for giggles, I won't do it in front of everybody, but I added, and I have it on my LinkedIn, I added ChatGPT 3 to my iPhone. And so I can hold down, well, I won't do it, but basically I can ask ChatGPT 3 and it'll talk. I have interlaced both, and I have a video on how to do it. So it's kind of fun. So that if you have ChatGPT 3 or knowledge, just put it on your iPhone. It's pretty fun. Let's see what else. Please add the group name in the chat. Yeah, I'll do that right now as other people ask questions.
Harvey, what does that do? If you put it on your cell phone, and it does what?
Okay, so you know how we can ask Siri for something and it always goes on the internet? Well, instead of going on the internet, it goes to ChatGPT and it asks ChatGPT when you're asking Siri. And then the output is ChatGPT via voice. Instead of having to type, you're just putting it on your phone, which is amazing. And so that's the next generation of things coming. I've seen companies that are already talking about using voice AI and adding it to ChatGPT. I was hoping that ChatGPT 4 was going to come out with what's called multimodality, but I found out from some friends that have inside information that that's not coming. What that would have done is the following. Had that technology been able to come out, you would be able to take a picture of a mole, put it into ChatGPT, and it would tell you what it is. You could do a clinical vignette, different things. You could do a picture of me, put it into ChatGPT, and then it would look at my face and recognize me and say, oh, that's Harvey Castro. It would do all these things. So apparently they were thinking of launching it, but it looks like they're going to wait for the next one after this one, possibly. So if that's the case, that's going to revolutionize medicine to another level. I mean, because there's already dermatology companies that do that. But if you could do that on this type of technology, it's just going to change. It's going to change so much. Let's see, are other companies creating spin-offs that are more clinically inclined? Yes. And so that's when I mentioned BioGPT, and someone mentioned MedPalm. Those are very specific to healthcare, specific to that. And that's a good point. Moving forward, I really think there's going to be multiple GPTs out there. Maybe for medicine, maybe one's for law. I think that is coming. As far as this stuff going away, it's not. It's here to stay. And that's why I'm an advocate for all of us to learn it, because this is going to be part of our daily life. Just like having an iPhone, it's going to be the same thing. It's just going to be AI behind us, just kind of constantly talking. Any EMRs integrating ChatGPT? Actually, yes. I've seen some companies out there that are playing with certain parts of the EMR. They don't want me to tell them what companies just yet, but they are looking to integrate the two. And like I said, once this API comes out, there's going to be, I really think there's going to be hundreds of different applications out. It's going to be overwhelming for the consumer. If anyone's interested in revenue cycle, there's a link. Okay, got it. But I really appreciate everyone's time. My goal here again was just to kind of educate everybody. It's really hard subject because it's, again, like the bell curve that I talk about. Some of you guys are probably better than me at ChatGPT, but then some other guys women have never heard of it. I'm from the East Coast. I always say guys. And so it's kind of a hard talk. And then it's kind of hard with it, healthcare as well. So, but I enjoy it. I love doing this kind of stuff, and I'm glad we had a good amount of people today.
Yeah, I think we I know we have a hard cutoff anyway, so this might be a good jumping off point. Let's make sure everyone has a chance to grab your information in the chat. I don't know if you want to type it in there one more time, so it's at the bottom
Sure.
and everyone can
Yeah, let's
see it. But we can also share that, and obviously you can find Harvey pretty easily.
Yeah, and then thanks, Harvey. I have written a few articles. Cool. So if I'm gonna try to hit the links here, so when we hang up, I have them. Thanks for those articles. I appreciate it. This stuff is fun and so much information to learn, but have fun with it. Play on ChatGPT, and I don't know, enjoy it.
All right, well, we'll give you the virtual applause here. Find the icon quick and give them an applause icon. There we go. Yay.
Thank you, guys.
Thank
I
you.
appreciate it.
Thank you for being here. Thank you for donating your time and helping us all. Obviously, Harvey wrote this book that you can buy on Amazon. I did. And then hopefully we can come back in half a year and and find out that you don't need doctors anymore. All you need to do is type in. You'll be cured. So the interesting thing that I think we will be hopefully dealing with is truly finding some new answers that were just beyond the grasp of people, and truly finding applications that can do multiply the workforce, making doctors better, making healthcare better, disseminating information in a better way, and overall improving access to healthcare and outcomes. So there we go. Thank you for sharing the book as well. With that, I will let everyone scoot off here and enjoy the rest of your evening. Again, Harvey, thank you so much for being here. And we will add you all to the SOPE mailing list, and hopefully we'll have one of these again pretty soon on Zoom. And other than that, have a nice evening in Dallas or wherever you are.
Thank you. Thanks, everybody.